Hey, Pussinette, new little video. This one will be a little bit different than what I usually do. I'm going to talk about one thing, and not a disease or a process, but more something that you should have in your kit. And the reason I'm going to talk about it is that I don't see many people talking about it in their videos, and yet it's a little bit like duct tape of the medical thing, is that it has many use, and I'm going to show a few of them here. And yeah, so what we're talking about is a foley catheter. So this is how I carry it, and this is the reason I carry that stuff. So because it's full of air, and as you can see, and this obviously is the one that I practice with and do my stuff with and stuff, so I would never put that in a person. As you can see, the little tip has already been broken and stuff. But there's a way that you can keep it sterile and very clean. And in their initial bag, I don't know if you'll be able to see, but this one, so initially when they come, they usually come in a bag, and they're sterile in the bag. And so what I did is I used this one, I fold it, and put it into this bag and vacuum it again more, so it's still sterile in this bag. It serves two things. The sterile bags that they come with is very easy to break, and they're very easy to tear or do anything, and then you lose your sterility. So versus this, it's very durable, it's waterproof, so it's very unlikely that I'll have. The second thing too, it's more easily to bring. It can vacuum the hell out of it and take off a lot of air, and so basically then it becomes very easy to hold on into your kit. Foley himself. So those Foley, if you've ever been in a hospital or something, this is a little catheter that we put. It's a catheter that we put into the bladder. So if you imagine that you have your my hand would be your bladder. You put the catheter in man or woman, and then after that, what you do is that you inflate a little balloon that is right here, and then because it's in the bladder, then now it cannot come out. This tip, as I can tell you, like it was a practice one, so the tip, but basically the tip here is still open, and the urine goes inside, and then basically you can drain. So the first use for that is monitoring your urine output. Very important in a lot of the patient that person that you would get. The reason is that if you have someone that is very sick, their urine output is very important to tell. A lot of the process that you have, depending on if you want to know if they're really dehydrated or something, of course there's some signs and stuff, but the best way is truly to know how much urine they're pulling out. This thing too, you won't, so even if they cannot pee, the urine is constant, because like I told you, this is open here, and so basically the urine drains constantly. So that means that every hour you can have an impression of what's the urine output of someone, and so the hour by hour now you can know about your treatment. So a lot of time that's what we use them in the hospital. Another use for it, sometimes people, either because their prostate is enlarged or other reason, they won't be able to urinate because they have something is blocking. So what we're going to do is put this catheter in. So let's say I got my blockage here, and it prevents my my urine to come out. Well, if I'm able to put the catheter past it, well then now the urine will be able to pass. So that's another use that we have this. So it's not for its intended use, but I mean right there already it's a good tool to have. But it has also a lot of other devices you can improvise with that stuff. First one, so let's talk about the balloon since we had it. So like I was going to say, so when you buy them over here, I don't know if you'll be able to see, but there's some information that comes over here. First of all, everything is in French. Don't know exactly why it is like that, but and French means is the diameter of it. So a 14 and greater the number, bigger it will be than that. So bigger the French, Bigger the catheter, bigger the gauge, smaller the gauge compared to the other ones. So this is it. So it will tell you your French, but as well as it will tell you the size of the balloon that is right here. So just to inflate the balloon, all you need, and actually you see it's that was all the syringe that I have. So this is one of my irrigation syringe. So that means that you can now use that for the same thing. You don't need to have exactly the size that it says, and you don't need like a tip that is connected. Obviously, it's a little bit easier if it's connected, but now I inflate the balloon. Once you inflate the balloon, take that off, and the balloon stays connected. So this balloon, because of this size, it can be used for different things. In nosebleed, sometime when they're not anterior but posterior, it's hard to control it. So even if you pinch them and stuff, because it's so posterior, it won't be. So in the emergency, sometime what we'll do, we have special devices that are made for the nose, but you can improvise one with a foley. So that means that I would put that in my nose on. So I would deflate the balloon, put some substance to make it go easier, because obviously this is kind of latex, so it's rubbery and it's hard to push. So you can put some gel or something like that, and then you would put that back in the nose, and then you would inflate the balloon, and then take off the syringe, and then you would pull until it kind of stopped. And what that would do is it would put pressure on the back of your nose, and then it could stop nasal bleed if they're posterior. So basically now you can control. You have a device that can help control bleed. Another thing that can be used for the nose, if anybody did some first aid course, a lot of the time you're familiar with those things, which is called OPAs, or oropharyngeal airway. And if you don't, I got a video also on airway management and stuff in my beginning. And the problem with those ones is that they're one size. Besides, if you buy like the one that I recommend, the one with from Newmask, that you can kind of cut. But those ones usually come like this, so you have to have all different sizes, and they're pretty big and bulky and plastics, and it's hard. And the other disadvantage of this thing is that you have to be unconscious to put that in, because as soon as I would have that gag reflex. I wouldn't be able to put that in a person that is breathing. There's another device that's called NPA, nasal pharyngeal airway. So OPA, oral pharyngeal airway, NPA, nasal pharyngeal airway. Both goes in the back there and kind of open the airway to the air, and so that even if my tongue goes down and stuff, it can still breathe. Well, you can improvise one with one of those. Basically, you would do the same thing that you would have done for the nosebleed, but this time you measure it. So the measure is basically from your nose to the lobe of your ear, and once you measure this, you have now a improvised NPA. So that means that now, and actually, even if you had cut this and you would put a either like something to hold it, so either a piece of tape or a safety pin through it, so that it stays inside the nose and doesn't go inside. So now I can have this. I still have a pretty decent size of a Foley. So that basically now, if I have somebody that is doing very badly, I could still use my Foley. Yes, I would lose my balloon on this side, but all I would have to do, because the balloon, all it does basically is hold this Foley in place, so that even if it pulls and stuff. So what you can do is tape it on the other side. So that basically now, if I have somebody that is doing very poorly, and I have to transport someone, let's say, and the patient is unconscious, and I have trouble, so that I need to monitor their urine output, and I have trouble maintaining their airway. With one of those, I can cut it, improvise an MPA, and on the other side, I can still use it for a Foley. I don't know exactly if that would be enough, but a lot of time when you put the Foley in, in the urethra, there's always still maneuver for to come out. So that would have to be seen, but probably it would be enough. I think so. So yeah, I think so. It would be. You would have just to discover it. So basically, when you put those in, you check if urine comes out. So that's how you would know. So yeah. So that would be one other. So another use, and we'll do a video on this, but they can be used as a tubing. So this is what many people latex, right? So as you can see, one of those are the needles that I showed a little kit before. And again, I'll do a video on explaining what I'm doing, and I need to experiment a little bit more. But I think you get the gist of what it can be used for. So kind of over here, and like I said, I'll do an experiment a little bit more and explain more, but it can be used for as a tubing as well. So as you can see, another use that could be used for is kind of last resort, but it could be used as a tourniquet. As you see, it's kind of elastic, and basically, and we see that in movies and stuff, but I could use that as a tourniquet. So just do a knots on there. There's better things that you can use than this, but it could be used. Another use I saw with this one is that you use the not so much the balloon this time, but if you as fluid can come out this way, it can also come in that way. So one advantage that you could use that for is so the use of it was right above the balloon, because it's a little bit more hard here. You put a condom and you tied it up. At the time, the doctor was using suture, but you could use pretty much anything that's going to hold it in place. It just has to be small as well. So probably like dental floss or something. And basically you tied it very well, so it becomes waterproof. So now what you can do with this is that if you enter some liquid in there, it's going to go into the condom, and because the condom can expand up to, I think, about 1 liter of fluid, what you can do now is control hemorrhage with that. And in some places they actually use the balloon itself, to control bleeding. So if you have and I'll put links for an article of that use. So if you have bleeding, mostly vaginally, now you can enter that in the vagina with the condom at the end attached, and then as you put the fluid, it's going to do pressure. So instead of having to put like your fist or something to hold it, now you can hold pressure. And like we all know, for hemorrhage, direct pressure is one of the great tools that you can use. Well, now that plays the pressure for that. Oh, hemorrhage control, nasal bleed control, urine output measured. If you have someone who is unconscious, you can use it for either an airway or a urine output. So many use. So I would encourage you to find some of those. And like I said, that's pretty much how I carry them. And I think they should make their way towards your kit. So anyway, hopefully that was helpful, and I'll talk to you soon.